Thank you, everyone, for joining us, and welcome to EllieMD's Alive Educational Series. We're so glad you're here. I'm EllieMD's social media manager and tonight's host, Brenda Rios. At EllieMD, we go beyond traditional telehealth. We're building a community rooted in education, innovation, and personalized support. The Men's Health Series is a part of our commitment to equipping you with practical tools and evidence-based strategies to take ownership of your health. Tonight, we're thrilled to welcome back Dr. Willie. He is known to his patients as a doctor of nursing practice who co-founded Core Health and Wellness alongside his wife. With over 23 years of surgical experience as an RN first assistant, Dr. Willie built his foundation in cardiovascular and open heart surgery before spending the last 15 years pioneering procedures and protocols in Da Vinci robotic surgery, working directly with Intuitive Surgical to help train the next generation of surgeons and assistants. In 2019, he completed his doctorate from Maryville University with a 2-year research study focused on the ketogenic diet as a first-line therapy for type 2 diabetes, a study that reflects exactly the kind of practitioner he is. Someone who doesn't just treat the problem, but goes and looks for the root cause and builds a better solution. Dr. Willie, thank you so much for joining us tonight. To kick things off, can you share a little bit about your journey and what led you from the surgical suite to the world of metabolic health and performance medicine?
Yeah, thanks for having me again. Love being here, love the community. So yeah, I've been blessed to be come at medicine from the outside in, right? So I started at 19 as a surgical, tech and kind of worked my way up through the whole system and always knew I kind of wanted to be in patient care. But not in the type of medicine that we typically see where we just kind of, have 5 to 10 minutes to spend with, the patient in primary care or in specialties and then just kind of just throw meds at them and run out the room, right? I got to initially deal a lot with professional athletes and did a lot with sports performance and recovery. And so what I kind of saw with them is what helped to really help them perform well and exceed, just translated very well to just people that just were metabolically unfit, which is pretty much half of the country. I mean, half of the patients coming in to see me have metabolic dysfunction, hormone disruption, things like that. So yeah, I take a whole, nutritional, holistic approach to the patient and have the blessed to be able to prescribe medications if I need to. But most of the time, I find myself actually, pulling medications off of patients. They come in and they're on like 8 to 10 meds, and most of them that they've kind of don't need. So yeah, blessed to use medication when I need to, and prescribe if I need to, but find other ways around that. But yeah, so spend a lot of time with patients, hour to, consult initially, to get to the root of everything. And to really just talk to them. Sometimes patients they just want to talk and explain to somebody, the things that are going on with them. And, once you just hear them and pay attention to them, you can really get down to what's wrong or what the actual diagnosis is. So yeah, I mean, peptides were up, peptides, I've been, involved with peptides for many, many years. So right when I saw EllieMD, it kind of like resonated really, really quickly. And this whole education series, I mean, it's just right down my alley. I think education is an extremely important part when you're talking about patients, rather than just saying, hey, take this medication, trust me. Most patients now with Chat GPT and the internet will go searching for themselves and find out all the negative side effects and wind up not taking it if you don't educate them properly. So I think when you educate them properly, like they'll have better outcomes. So yeah.
Mm. Yeah, and I love that you mentioned the education part because before we jumped on live, you were talking about how some of your patients will come on and they're on a peptide, but they're not making those lifestyle changes.
Yep.
So having that educational part is so important because they need to understand their body, like what they really need to do to start seeing those benefits.
Mhm. Yeah, peptides are extremely important, but remember they're tools. Anytime you're
Mm.
talking to people, like they're tools, and they're only going to help so much if their diet, nutrition, hydration is not great. They're not exercising or moving. They're not sleeping well or prioritizing sleep. Their emotional, spiritual health is not great. And then medications, hormones, and peptides have an important spot.
And we'll definitely dive into that, but taking it back a little bit, I want to kick things off with age. So, why does recovery get harder for men, especially when they're aging? Like, what is actually changing hormonally and physiologically that makes it so much more harder to bounce back?
Yeah, so one of the biggest this is one of my favorite topics because, guys especially are really good at, train, but nobody, does the recovery piece. And that's actually when you grow, when you recover. Now, as we get older, like one of the biggest misconceptions that men have is that aging is simply about getting older, like chronologically, like by a number, right, or age. But what's really happening is we're losing recovery capacity biologically. So after about age 30, men especially, we start to see gradual declines of like testosterone, right? Growth hormone, especially after 30, 35, IGF-1, mitochondrial efficiency goes down, collagen production goes down, blood flow goes down, and even our nervous system resilience like drops. But at the same time, inflammation tends to increase while like tissue repair slows down. So you have this mismatch where a lot of guys, that and myself included, we're training with the intensity of a 25-year-old, but now we're recovering with the physiology of like a 45-year-old. So that's where, what that feels like is like soreness lingers longer. We tend to be sore when we used to bounce back. Sleep becomes a lot more important. Joints start kind of talking back to us, and little injuries that we had that used to heal with no problem, they just stop healing or don't heal as quick. So
Yeah, and you mentioned like the soreness. So, a lot of men push through soreness, the joint pain, the slow recovery because they think it's a part of the deal. So it's just train, like you mentioned. But at what point does that mentality actually start working against them? What's the real cost of ignoring those signals?
well, that's the thing is like I explained, you know, training is digging a hole, recovery is filling that hole back in. And most of us are really good at digging the hole, but not filling that hole back in. And that could look like, protein and active recovery. But, that push through it mentality, that like no pain, no gain, it works, right? Until it doesn't. And the older we get, the less that works, right? So, pain and prolonged soreness, are often the body kind of signaling to us that we have unresolved inflammation, we have, tissue overload or poor recovery. uh, you know, th- the problem is that as men, we're really good at compensating until suddenly we can't, right? So we'll keep going until we just can't. So the cost of ignoring those signals is like kind of minor tissue irritation, becomes like chronic tendinopathy. Like, we get like these tendonitis, cartilage degeneration, labral tears and disc issues, and then even like just systemic burnout, from CNS. So, the body keeps a score. So recovery debt accumulates over time. And so we just have to be real mindful and actually start paying because in the past, we didn't really have to think about recovery. When you're in your 20s, and you recover no matter what you do training wise. But over 30 we start to learn that, for sure over 40, that it gets harder and harder. We have to do all the little things.
And now, with connective tissues such as the tendons, the ligaments, the cartilage, they could be already slow to heal even with younger men. What makes those structures so vulnerable to break down over time? And why do so many men end up with chronic joint issues that never fully resolve?
Well, the thing about it is, if you think about it, connective tissue itself has really poor blood supply compared to muscles. That's why, they tend to last longer. So tendon and cartilage, they don't receive the same nutrients, oxygen, and repair signals at the same speed that muscle tissue does. So as we get older, again, the collagen synthesis decreases, growth hormone declines, blood flow decreases, which if you already have a tendon or ligament that has poor blood flow as it is, and then the older we get, that blood flow decreases, it gets even worse. Glycation as we get older, so glycation stiffens tissue. So glycation is something that happens because of our diet. So glycation is, we get what's called AGEs, or advanced glycation end products, and that's from a high sugar diet, our high like carbohydrate standard American diet that most people are on. And then that chronic inflammation just accumulates. So that itself creates our tissues that they're less elastic, less hydrated, and they're weaker structurally, and they're slower to remodel. So it takes a lot longer to heal that, especially the older we get. So that's why we often, as men, like feel stiff, and why tendon injuries become chronic instead of just acute, and we heal right away like we used to.
hmm And you mentioned that these levels are already declining with men in their 30s, in particular with men who already are in their 40s. But going back to the growth hormones, so like we're seeing it with men who are in their 30s, those growth hormone levels are already declining. What does that decline actually mean for a man who is still training hard, still trying to perform, and wondering why his body isn't responding the way that it used to before?
Well, growth hormone itself is not just about muscle growth. It regulates tissue repair because remember, like when we're younger, we repair really, really quickly. Collagen turnover, sleep quality. So as growth hormone goes down, I mean, our sleep quality gets older. I mean, gets worse. As we get older, our sleep quality gets worse. Fat metabolism, so we get a little bit of visceral fat. Well, visceral, it's a really bad cycle because visceral fat drops growth hormone, and then as growth hormone drops, our visceral fat goes up. So it's just like this vicious circle, and just recovery and cellular regeneration drop. So, you know, when our growth hormone declines, we get slow recovery, less resilience, more visceral fat, like I said, in that cycle, worse sleep, which then that's when we pulse growth hormone is in deep wave, slow wave sleep. And if we get poor sleep or worse sleep, we pulse less growth hormone. So again, it's this vicious cycle, and then that'll lead to decreased lean mass, more nagging injuries. So a guy can still train hard, but his ability to adapt and rebuild from that training is diminished, specifically from the growth hormone. And then also we get into like the testosterone and other issues. But yes, that's just the growth hormone.
Mm. Now, I want to dive into peptides a little. So, we know tesamorelin and ipamorelin are one of the favorite stacks for
Mhm.
recovery. So, why are they often paired together for men's performance and the recovery protocol? And can you break down what each one is doing individually and why combining them creates a more complete effect for men?
Yeah, sure. So tesamorelin itself is a GHRH analog. So that's a growth hormone releasing hormone analog. So it tells the pituitary to produce more growth hormone. That's basically what tesamorelin does. So, and for people that say that about peptides are not FDA approved, tesamorelin was FDA approved back in 2010 under the name Egrifta, and even more recently, like in 2019, there was a newer version that came out. And even as late as just last year, 2025, Egrifta WR, or what stands for Weekly Reconstitution, came out, and that's the newest version. But understand that like the brand name Egrifta, it without insurance is about $10,000 a month. So it's extremely expensive, but it is FDA approved. The ipamorelin it's more like a ghrelin mimetic, GHRP. It's a growth hormone releasing peptide. So it stimulates a pulsatile growth hormone release without significantly raising cortisol or prolactin. So that's real important. Together, they're real synergistic, and they're more physio they produce a more physiological growth hormone optimization pathway. So you get stronger growth hormone pulses, you get better IGF-1 support, improved recovery, better fat metabolism, better sleep, and better tissue repair. So the easiest way to think about it is like tesamorelin provides the signal, and then ipamorelin amplifies that pulse. So the synergy is why they pair so well.
Mhm. And beyond body composition, what specific role does growth hormone play in joint health, tendon repair, and connective tissue integrity for men? And how does supporting, oh, let me stop there because I think this
Mhm.
is a two-sided question.
Yeah.
So let's start with that one
Yeah,
first.
so the body composition that's huge and underappreciated. Like that's so when people ask me all the time, they're like, "Hey, there's so many peptides. If I was just to pick one peptide for male or female, my wife just recently asked me this, what would it be?" and I would say testosterone umbrella. I mean, it's the largest umbrella that covers the most bases. So like if you have to just you're hard pressed unless you're very specific. I recommend testosterone umbrella. So the growth hormone IGF-1, it's important for that because it's deeply involved with, again, going back to the collagen synthesis, the tendon remodeling, cartilage maintenance, fibroblast activation, which is, hardly ever talked about, and tissue hydration. So, like again, when growth hormone declines, our tissues are weaker, stiffer, slower to heal, more injury prone. So, again, like supporting all the GH pathways with the peptides, it helps restore kind of the regenerative signaling. Remember that peptides are signaling molecules that aging gradually takes away. So always remember that like peptides, we're not adding something back in that we don't have. We're just amplifying the signals that we already have.
Mm. And while we're on the topic of tesamorelin, I want to get to this question from Callie. She asks, is there still visceral fat reduction with Tesa KPV?
Yes, because the Tesla that was specifically what it was developed for. So if you understand what the FDA approval originally was for Egrifta for tesamorelin was for reducing visceral fat in AIDS patients. AIDS patients tended to get what's called lipodystrophy, which is like just visceral fat distribution, and that's specifically what it was developed for. So yes, the tesamorelin with the KPV, it will help with it will help with the visceral fat reduction also.
And what about with Summerlin? That's her second part of the question.
So here's the thing is like a lot of people sleep on Cimarron, and that was the OG. That was the original one that we had for years and years and years. And it works really well. And honestly, for all the talk that testosterone is more powerful, and I have a handful of patients. I have a lot of people that actually like did some, Cimarron and then went to testosterone and said that they had a better effect and felt better on Cimarron and went back to Cimarron. So and so I've had that multiple times happen. So don't feel like it's a weaker one or not as effective. It just everybody's a genetic individual. So some people feel better on Sermorelin, some people feel better on Tesmorelin. I do see that women sometimes do better on Sermorelin. But they can also, it just depends. It depends. Everybody's a genetic individual. So
That I had a similar experience. I started off with Summerlin and I felt so good on it. I definitely felt that I was getting toner. And then I
yeah,
heard all about tesamorelin
yeah,
and the visceral fat reduction. So I thought, okay, let me try that next. And I
yeah.
did, but I felt exactly what you're saying. I felt like I had better results with Summerlin.
Yeah. And here at my office, I do a lot of DEXA scans initially. So
Mm,
my DEXA scan has the VAT score, has a visceral adipose tissue program on it. So like along with the lean body mass, body fat, bone density, I also run a VAT score. So I actually track VAT scores with, peptide therapy. And like I see it across the board. Maybe you could see slightly better with testosterone, but as far as like overall results, Samarillion works just as well.
mm. And we had another question come in. What if you're wanting to build muscle mass? Is there one that's better? Is it just dependent on the individual?
Yeah, again, I've seen people build with Cimarellin and build with Tesmarellin and Ipamorelin. So
Mm,
I would say probably for muscle growth, I would say probably the Tesmarellin and Ipamorelin just because you have the GHRH, GHRP, signaling pathway, and you get a little bit stronger growth hormone pulse. Now, very important, a lot of people don't realize it, it does make a difference if you do it fasted at night or if you just ate because it's going to lower. Now, it's not going to make the testosterone ineffective, but it's going to lower that pulse. So you want as strong of a growth hormone pulse as you can. So the longer you're fasted, at least like 2 to 3 hours after your last meal, that's the ideal time at night to take the testosterone.
mm,
So that's a big mistake a lot of people make.
hmm. And now going into another peptide stack that's often used together in men's protocols, which is BPC 157 and TB 500.
Mhm.
What do each one of those bring individually, and why should they be combined together?
Yeah, this one I can tell you personally speaking, it has healed many, many of my injuries very, very quickly. And I love BPC, and for all the noise online of the naysayers and the people that, you shouldn't be using it, it doesn't work. There's a reason that WADA, the World Anti-Doping Association, has BPC 157 banned because it provides such good healing. Okay. So BPC and TB 500, in my opinion, they should always be used together. There's no reason to use BPC by itself without TB 500 because they're so synergistic. So the BPC itself is heavily involved with like angiogenesis, or that's the making of new blood vessels, right? Gut repair, even the injectable. Some people, I will make this distinction. A lot of people think that taking the gut one, the oral one, is just as good for like systemic, like joint repair. While you'll still have some people that feel a benefit, the systemic injury repair or joint repair is going to be better with the injection. So gut repair more so with the oral. You do get it with the injection too. Tendon healing, nitric oxide signaling, which is real important, especially for men as we get older, because that's a missing piece of men's sexual health, is nitric oxide, and localized tissue repair. So the TB500 is more systemic and supports cellular migration, inflammation modulation, and it's a very potent anti-inflammatory, really potent anti-inflammatory. So it's real important. It also has a lot to do with actin remodeling. So actin it's one of the most important structural proteins in the human body. Like, it's super important. So what actin remodeling is basically, it's critical for like wound healing, tendon repair, tissue regeneration, collagen, and collagen remodeling. So and it just provides overall recovery throughout the body. So the way you can think about it is BPC tends to work more locally, and the TB500 tends to work more globally, like the whole system. So together, they're real comprehensive. They kind of create a real comprehensive tissue recovery environment. So I like using them both together.
And we had a few questions come in on that stack. How does it affect Crohn's disease?
No way to the oral. So I can tell you from personal experience, the oral always, and again, I'm gonna pose this as, it should always be adjunct. Okay, it should never be primary. But I can tell you personally, for Crohn's, for UC or ulcerative colitis or IBS, I use it in conjunction. The oral BPC 157, I use it in conjunction with other things that I prescribe for that, and it has been made like it works very, very well for healing and recovery of the gut, especially if they have flares, and they have ulcerations, from flares. It works really, really well. But the oral, I would now, if they tolerate oral, the injection can help with the gut, but the oral is a little bit more gut specific. So I would always use a BPC oral with it.
Mm. And while we're still on TB, maybe just because we have a few more questions, any thoughts on TB BPC for plantar fasciitis?
Plantar fasciitis, yeah.
Mm.
So it depends. Is there a structural issue? Because that's another one where, like, BPC, it's going to help with, like, say, okay, let's just say somebody has a rotator cuff, if they have tendonitis. Okay, it's going to help lower the inflammation. If you have a full rotator cuff tear, it's not going to magically heal. Now, I have seen many cases where somebody has had tendinosis or fraying of the tendon, and we're told they needed surgery, and then after using a round of BPC, didn't need the surgery anymore, and that was like MRI confirmed. But as far as like a full tear, no. The same thing with structural, like, with plantar fasciitis, is there a lot of times there'll be a bony spur that's chronic. It's almost like rubbing a rope across a rock. And so if they have that, unless they remove that structural issue of that spur, they may continue to have plantar fasciitis. Now, um, there's a lot of debate whether you need to inject in the area. You don't have to actually inject in the area of injury, just near it. And if you do near, you can do systemic, it works. What I have seen, is that if you inject it near the site of injury, that it'll migrate to that area of injury and speed up healing.
Mm.
It doesn't
That's
have to be
actually
direct.
Yeah, we actually had one of those questions come in because from past educational series, that was a question that we got asked a lot if they have an injury. And
Mhm.
an example, this one that just came in. So there's a hockey injury on the back. Where should they inject? And like I mentioned, we've had it asked before if they should inject closer to the
You
problem
can do it.
area or is it
Yeah,
fine
you can
anywhere?
do it near. It doesn't have to be right at the area. But like for instance, I tore my tricep across the muscle belly a few years ago, and you're talking about probably about a 4 to 6 month like recovery injury. It wasn't at the insertion, but it was across the belly. But still, you're talking about a 4 to 6 month. I was training again in about 4 to 6 weeks, and I was injecting kind of around the area, not directly in the area. Now, for again, because of the systemic nature of TB 500, it will still work if you do it, love handle, belly, sub Q. But we have seen where, if it's a shoulder, if it's an elbow, you can do it near the area of injury, and it tends to, and whether I doubt it's placebo, but whether it's placebo or not, like they all report, oh, I felt better much quicker than when I injected, love handle or belly. So
Hmm.
yeah.
Good
But
to
for the back,
know.
I would say just close. It doesn't have to be right in the area of injury, but near the area of
Hmm.
injury, and it kind of migrates to it. Yeah.
Hmm. Now, another peptide that doesn't get talked about as much in men's health is GHKCU, and it probably should.
Yeah.
So, what is it doing structurally and at the tissue level that makes it very important for men focused on performance, recovery, longevity?
So yeah, so men should care about, just like a lot of people think that it's just for like, you know, the glow and like for women and skin and nails and hair and but honestly, the GHKCU, it's involved with a lot of again, going back, collagen remodeling, wound healing. There's a lot of data on that, on tissue regeneration, stem cell signaling. Remember, peptides are signaling molecules. With GHKCU, it tends to signal stem cells a lot, and anti-inflammatory pathways. So some of the like the larger uh, PM&R, facilities that do their physical medicine or rehab, that do like stem cell injections, PRP injections. A lot of them are actually, recommending doing GHKCU along with like PRP and things like that long term. But it also appears GHK also has been shown and appears to like influence gene expression related to like aging and tissue repair. So it's not just a skin peptide like a lot of people think. It's a tissue integrity peptide. So men should really care about it. But for men trying to stay structurally like durable, well into their 40s, 50s, and beyond, it matters tremendously. It matters a lot. So yeah, guys should really, really care about GHKCU.
And on the structural integrity and collagen, collagen loss is something that's really often talked about with women and not as much with men, but it does affect the joints, the tendons, as you mentioned, the structural integrity. So, how do peptides like GHK and BPC 157 support collagen production in a way that actually is moving the needle for men?
Well, everybody needs to remember that collagen isn't just cosmetic, right? So it's structural. So both of these peptides will help, like I said earlier, activate fibroblasts. They support extracellular like matrix remodeling, improves angiogenesis or that blood flow, especially with the BPC, and just healthier tissue regeneration overall. So that's going to affect your tendons, ligaments, things like that. Because again, I think with a lot of the play, I think with GHKCU, they think it's like for appearance and aesthetics, and it has a lot more to do with the collagen regeneration with the tendons, ligaments, fascia, cartilage. Just like that. Plantar fasciitis. It's a inflammation of the fascia on the bottom, on the sole of the foot, skin, and even like vascular tissue. So uh, men often think that they're losing performance because of muscle, when in reality, they're actually losing connective tissue resilience, like because of collagen loss. So yeah, the guys should really, really, think about GHKCU and especially like BPC is one of my favorites.
Mm. And this was a really interesting question that just came in, because he's talking about what can you expect when you're switching from BPC, TB, and then going into CLO, because now you're adding GHK. So is
Mhm.
there any differences that they're seeing or they might experience?
Well, along with the faster healing or better recovery, they are going to see like guys are going to see better like skin. It improves like collagen and type 1 collagen and elastin. So elastin is what kind of makes our skin kind of snap back, and kind of when we lose it as we get older, that's what makes us sag and have wrinkles I mean, along with a lot of other things. But it's way beyond just like cosmetic, but they will see the aesthetic portion of it. And that's the thing is like, we are living better longer, and that's the goal, right? Like extending health span. But like peptides are going to help with that like aesthetic function. In the clo, it's going to help with the aesthetic. They basically help them look better. And then you're adding in that GHKCU, BPC that they're just going to heal just that little bit better, or recover just that little bit better, also because of that collagen restructuring.
Mm. And I want to take it back a step and go back to inflammation. So men tend to train through inflammation rather than address it. So how do these peptides help the body find the right balance, enough inflammation to heal, and not so much that it's going to stall recovery and performance?
Well, just remember that like inflammation itself is not bad, right? And we need healing requires inflammation. I mean, when we lift, we tear muscle, we have that inflammatory response. The problem is like chronic unresolved inflammation. So that's where the peptides, really tend to help, because they regulate the inflammatory signaling, and so they do that balancing for us. So we don't have that. So the way I talk about it, almost the way I talk about it with like metabolic dysfunction, right? Like, so we talk about insulin, right? Insulin for metabolic dysfunction, insulin is like heat or fire, right? Think about like a little bit is great. It heats your house, cooks your food, right? Too much fire burns your house down. Too much insulin, not good. Same thing with this. Too much inflammation, like is where the tissue degeneration happens. So, these peptides will help like improve tissue repair efficiency, the vascular flow, so your ligaments and tendons heal better, and just they'll just accelerate the resolution of the injury response. So the goal is not going to be suppressing the inflammation completely. The goal is like controlled inflammation followed by like efficient recovery. And that's kind of the sweet spot for performance, because it allows you to come back, sooner and better
Mhm.
with
If
less injury.
For a man who's still showing up to train, putting in the work, but he's noticing that maybe his joints are more beat up, recovery's taking a little bit longer, performance has plateaued. What does an optimized peptide protocol look like for an individual like that?
Well, it depends how active they are. My answer, anytime they ask me a question, my answer always starts with it depends. Like it depends on the goal, right? Like, so an amazing, great peptide for guys that are wanting to perform and recover, depending on their training, schedule or status, is, like I said, testosterone, lipomorelin. That's especially with muscle maintenance, muscle growth, and then something for recovery, whether like the be all end all would be Clo. But at the very least, if they're going to do, they could like the way I explain it to patients is I will tell them, hey, for the long haul, it's going to be testosterone, lipomorelin. I want you to take it about for minimum 4 to 6 months. That's where, they're going to be the long haul one. And then I want you to sprinkle in, then you can sprinkle in BPC 157 for a couple of months, and then maybe switch to GHKCU for a couple of months. I mean, in a perfect world, like, testosterone, lipomorelin, and Clo would be amazing stack. But the way I explain it to patients, just from a monetary standpoint, right, is test more lipomorelin long term, and then sprinkle in BPC, TB, GHKCU. You know, if they're having any fatigue, maybe a mix of like NAD and MOTS-C, for a run. It just always depends on what their specific goal is. But yeah, that would
Mhm.
be a great stack. Would be test more lipomorelin and like either BPC or club.
Yeah, and you mentioned MOTS-C,
Mhm.
and I want to tie it into a question that we just got. Can you talk about MOTS-C for men?
Yeah. So MOTS-C is what we call an exercise mimetic. So it's going to mimic a lot of the responses that happen when we're exercising. This is really, really great, especially like for elderly who can't move that much, right? But you also have to treat it like exercise, right? Like that's why we don't want you doing it Monday through Friday. If you do find this is a little known fact, if you do find that you're getting tired, while taking MOTS-C, um, it might be a combination of training, overtraining, and then also the MOTS-C. So I always tell them, hey, cut back a little bit instead of like the Monday, Wednesday, Friday. Maybe do it twice a week. Maybe do it once a week for a while and extend it out. But and then usually that kind of like fatigue and tired feeling like resolves. But it's like you're overstimulating the body because remember it's an exercise mimetic. So it pairs very, very, very well with like NAD plus very, very well. So I'm a huge proponent of that, especially if somebody comes in like talking about, fatigue. And especially like if they're 40, 50 plus, I mean, they're going to be more likely to have declines in mitochondrial efficiency. I mean, not really your 20, 30-year-olds, right? If they're healthy, just like a 20-year-old most likely will probably not benefit from a growth hormone peptide because their growth hormone is still pretty high, right? That's somebody that's 30, 40, 50 is going to benefit a lot more from that. But like MOTS-C is going to be more helpful if you're like have kind of like fatigue and again I think it really works paired well with NAD.
That's my current protocol right now. We'll
Mhm.
stack in NAD with MOTS-C.
Lots of-
So
yeah.
super excited for it. Now,
Yeah.
as we wrap up, what's one thing that you want men on this call to understand about recovery, peptides, and long-term performance? And why is it important to take care of your body now if for them to have that competitive advantage for like the next few decades?
Well, the reason is because like I mean so there's this whole saying, where did I put it? The whole saying is, and guys will guy all my guys will resonate with this. Oh, where did I put it? So basically, it goes kind of like in your 20s, I want to be huge, right? In my 30s, I want to perform well. In my 40s, I just want, to recover well. And then in my 50s, I just want to get out of bed without hurting, you know. And so it's important to understand that these are really, really important tools. The peptides are not magic, right? You got to be doing all the pieces, but understanding that the goal is like optimization, not replacing biology like unnecessarily. So like it's real important to start taking care of now because the thing is like we get way down the road as men we get, yeah, I'll take care of it later, or it's not that important. Recovery is extremely, extremely important, and that's when you grow. Like I think it's not being I don't think it's been framed properly, right? It was just we've always been told to let's train more, train harder, and not realizing that it's actually in the recovery that we grow, that we respond, that allows us to come back and train hard again. But so yeah, I mean it is extremely important. And the biggest thing is like utilizing these peptides again when everything else, like if your hormonal balance is good, if your diet and your exercise is on point and you're sleeping and you're prioritizing sleep, then peptides are really, really, really amazing. They're an important tool, but it's going to be real important to pay attention to the body because I mean, if you have lingering soreness, declining performance, poor sleep, increase injury frequency, right, tendon pain, reduce. This is another thing that I hope we have in the future. I do a lot with men's sexual health, and it's extremely important, especially as we get 40, 50 on. Men's sexual health is extremely important. So, it just, the peptides will really, really, really help. But, you know, the biggest thing that we really need to pay attention to is preserving our recovery capacity. It just is as we get older. So we, as men, we obsess about like our performance and PRs and body composition and intensity and but longevity and performance comes from like the recovery, the tissue resilience, the hormonal optimization, inflammation control. So the goal is not just to stay strong at 30 and 40, it's still being capable, athletic, mobile, and resilient at like 55 and 65. So
Mhm.
I found my quote. So it was basically, it's a joke that gets circulated around, but it's like at 25 you train to look good naked. At 35 you train for performance. At 45 we train for longevity, and at 55 you train because your back hurts if you don't. so so it's real important to move.
I
So
love that. Yeah. Yeah, I
yeah.
cannot agree more about making those lifestyle changes. That's really where you're gonna, at least for me, that's where I saw like you truly see the benefits and recovery. I'm in my 30s now, and I just
Just
realizing now
wait.
how important it is.
Just wait. Well, the thing is, it's amazing when I see people your age actually start paying attention to their health, because like I think back, I'm like, God, I wish I'd always been in health and wellness, but there was a period there between like 25, 35 that I kind of like, raising a family, you get busy, you kind of step away, you get out of shape a little bit. And I wish I'd been a little bit more attentive, but the men who take recovery seriously early, and I say men and women. The men and women that take, recovery seriously early are the ones that are gonna like stay most productive and in the game the longest. Period.
100%. Amazing. Thank you so much, Dr. Willie, for
You're
helping
welcome.
educate us. This is really amazing. We got a lot of love in the comments. Sandra
Good.
says, excellent call, great information. So, to those who weren't able to make it, we'll have the replay at the end of the week. And thank you again so much, Dr. Willie.
No
And I'm
problem.
excited to see you in person next week
Yeah,
at our convention.
we will see you all next week. Thank
Mhm.
y'all for having me again.
Have a good night, everyone. If you were invited to this call by someone, please reach out to them. Have a good night. Thank you again, Dr. Willie.
Good night.